You guys hear me okay?
Yes.
Okay,
Yes.
thank you. Okay. All right, we'll get started. So we're already on week 5. I can't believe it. We're like almost halfway through. So today's lunch and learn is going to be on cardiovascular and metabolic health conditions and how our lifestyle and our exercise and diet choices and stuff can impact that and what you can do to stay healthy and avoid some of those issues. And then we'll talk about a little bit about what next week's challenge focuses will be on. So we'll get started. Cardiovascular health and metabolic health, obviously, these are systems that involve our heart and lungs and circulation systems, and also our metabolism and those systems that help with chemical reactions throughout our body. We'll start with the cardiovascular system first. This is your heart, your blood vessels, your circulation system, if you remember from anatomy class back in school. The most common heart health issues that we're suffering from here in America are coronary artery disease. So this is where your heart attacks and stuff would fall under. Strokes, high blood pressure, hypertension, and atherosclerosis, which also can lead to heart attacks and strokes as well. Atherosclerosis means hardening of, so it's when your arteries get hard, and that essentially leads to more plaque buildup, which is where coronary artery disease then kicks in, and then that leads to strokes and heart attacks. So they just all build on each other. We'll talk a little bit. Some of you guys are part of businesses where the health department comes out and does biometric screenings. So we'll measure things like your cholesterol and your triglycerides and your blood sugars. And that's all to kind of gauge someone's risk for cardiovascular diseases and their cardiovascular health. Likely when you go to your healthcare provider, they're also taking these metabolic measurements probably every at least 5 years, if not more common based on what your age is and why are they doing that. The first thing is they're looking at your lipid profile. What are sort of the fat molecules doing in your body and why are they measuring them? The ones I want you to focus on, and the ones that hopefully your providers are focusing on, are your HDL cholesterol numbers and your triglycerides in relation to what your overall cholesterol looks like. If we would have done this presentation 20 years ago, the information we'd be giving on cholesterol would look a lot different than the information we give now on cholesterol. When I was going to school, cholesterol was thought as the main culprit of causing heart disease and heart attacks. But that science has certainly changed over the last 20 plus years. And so what we used to think of as cholesterol being bad in general is now not the case. There are certain cholesterol molecules that can be indicators for poor heart health, but most of the time, good cholesterol does exist and is necessary and can be a protective factor against cardiovascular issues. So this TC here stands for total cholesterol, and HDL is a component of total cholesterol. It's a healthy lipoprotein molecule that circulates in the blood, and it's anti-inflammatory in nature. So it's basically like the garbage truck. It goes around and cleans up all the crap in your arteries to help your body get rid of them. So these are good molecules to have. The more garbage trucks, the better. HDL is generally raised through physical activity. That's the best way for us to keep it up. But you can also eat it and find it in healthy fats, which is another great way, again, that correlates with like the reason we want to eat healthy fats in our diet from previous lessons. The ratio between your total cholesterol and your HDL, you'd like below 4. If you've ever seen your measurements on your metabolic results sheets from your doctor. Ideally, closer to 2 is optimal, but anything under 4 is considered lower risk for cardiovascular disease. Another thing to look at is what are your triglycerides doing? Triglycerides are the actual markers of inflammation and plaque buildup. Cholesterol is more so a lipoprotein molecule. Triglycerides are fat. They're actual fat molecules. And it's not from eating too much fat. It's just an indicator that you have or your body is storing a lot of fat. And that's usually indicative of a poor lifestyle. If you remember from our other sessions, the body can only store so much protein and sugars And so all of that excess calorie, primarily those excess sugars that we're eating, are converted to triglycerides. That's the easiest way for the body to store fat, is as a triglyceride. So if your triglycerides are elevated, that's a pretty good indicator that we've got a lot of inflammation and or plaque buildup happening in our system. So we want our triglycerides to be less than 150 milligrams. Optimal is around 70. So if you can get into the double digits, that's great. That's really a good health marker for you. And then another one is that middle one, the triglyceride to HDL ratio. If you can have that combination less than 2, that's also a good indicator. Basically means you've got enough good HDL floating around, those garbage trucks going around to pick up the junk of your triglycerides, right? So some things to look at: if you can pull up your most recent health report from your doctor or labs you had ran, you can kind of give a little glance to see what your risk might be based on your lipid profile. Resting heart rate is another good way to assess your cardiovascular health, and this is a good resting heart rate is generally between 60 and 80 beats a minute. So if you know how to check your heart rate, count it for a minute and see where you're at. You want to do this in a resting state, so be at your desk for 5 to 10 minutes. The best time to take it is when you get up right away. Just lay in bed or sit at the side and sit there and take your pulse. When it's too high, that just means the body's just, it's taking a little bit more to work the body, and that just puts stress on our organs, which ultimately we're going to talk about stress next week and the dangers of that, but that just increases our risk for heart disease as well. If it's low, it could mean many different things. Most of the time, if it's below 60 and you feel like you're healthy, it's probably fine. It just means you're in great cardiovascular fitness health. Like I think I read once, like Lance Armstrong, when he was at his peak in performance, his resting heart rate was like at 37 or something. It was like so low and efficient. Tobacco use, if of all else, if you're using tobacco, this is the number one thing to cut out of your life to have the most impact in reducing your risk for cardiovascular disease. It has no benefit to the body and certainly a lot of harm to the body. And for sure, the number one thing is heart disease and lung diseases. So 1-800-QUIT-NOW is a free resource to Iowans. So if you are someone who needs help quitting tobacco or nicotine, that's a good first place to start. You can call the health department. We can get you additional resources too, but I think we all know that tobacco is not something that's helping us. And then, of course, our lifestyle. We've been talking about these throughout the sessions, but regular exercise is certainly important. Diet, we're going to talk about a little bit more, and then we're going to talk about chronic stress next week, but we'll touch on that a little bit today. I'm going to go through, we're going to watch a quick video on cholesterol. Some of you who work at the health department have probably seen this video like 30 times, so I apologize. You can tune out for a while. But as I mentioned, cholesterol is not quite the best indicator of heart disease as we once thought it was, and sometimes our older doctors still tend to think of it as the number one indicator. So just think this is a video of a provider who kind of goes through how the science has been changing over the last couple decades, where cholesterol is no longer thought of as necessarily the bad guy. High-fat diets also aren't necessarily the reason we're getting high cholesterol. It more so is those excess sugars and processed foods we're eating, like we've been learning about all this time. And of course, cholesterol is essential. It's super helpful for a lot of different functions in the body. So by getting it too low, we can end up getting more issues and illnesses that are associated with low cholesterol that you might not be familiar with. So anyways, we'll go into this real quick. Let me know if you can't hear it, but you should be able to. I tried to test it once already. So
hi, this is Dr. Mark Hyman. Welcome to my weekly house call, your chance to ask me your questions. And this week's question is, my doctor says my LDL cholesterol is really high and he's concerned, but I saw in your videos that cholesterol is complicated and now you're saying that I should eat more fat, which should improve my cholesterol. I thought fat was the last thing I should be eating. I'm so confused. My doctor didn't tell me anything about this. Can you explain for me? Well, look, I know it's confusing. There's so much outdated research still being preached by the media, scientists, and even our doctors. The truth about cholesterol is much more complicated than we thought. Now, I'm sure most of us believe that eating cholesterol and fat, and especially saturated fat, causes heart attacks, and that taking statin drugs are a powerful way to reduce your risk of heart attacks. But is this really true? One of the biggest myths out there is around cholesterol and fat and heart disease. Specifically, that cholesterol is the enemy and that a high-fat diet causes heart attacks. If you think cholesterol is the enemy, think again. Your body needs cholesterol to make your hormones, your cell membranes, and even your brain cells. Without enough cholesterol, your testosterone levels would drop and your sex drive and function would plummet. And your cell membranes, which are made of cholesterol, couldn't function properly. So it's not about having lower cholesterol. It's about having the right type of cholesterol. We're all terrified of cholesterol because for years, well-meaning doctors, echoed by the media and the drug companies, have emphasized what we believe to be an intimate link between cholesterol and death and heart disease. If only it were so simple. The truth is much more complex. Cholesterol is only one factor among many and may not even be the most important one that contributes to a risk of getting heart disease. Things like inflammation and diabetes, that little bit of belly fat to prediabetes to full-blown type 2 diabetes are actually the real causes of heart attacks. Part of the reason that saturated fat got a bad rap is that we had a singular focus on LDL cholesterol being the most important cause of heart disease. Now, for a long while, we didn't know that fat actually increased the good type of LDL and increased also HDL, or good cholesterol, having no impact or even a beneficial impact on the total cholesterol to HDL ratio, which is actually the best predictor of heart disease. Guess what has the biggest and the worst impact on that ratio? It's sugar and carbs, because they lower HDL and they raise triglycerides and also increase the number of bad cholesterol particles. Since cholesterol deposits are found in the arteries of people with heart disease, it seems logical that if you eat cholesterol or saturated fat, which raises total cholesterol and LDL cholesterol, then you shouldn't eat fat or cholesterol. Yet study after study has shown no link between total fat and even saturated fat or dietary cholesterol and heart disease. In fact, a review of 72 studies of almost 600,000 people found no link between total or saturated fat and heart disease. But they did find that trans fat were clearly harmful and omega-3 fats were beneficial. What most doctors and drug company commercials don't tell you about are the studies that show that most people who have heart attacks have normal cholesterol and not from taking statin medication. Yet because we have drugs that lower cholesterol, that's what we focus on. Now, there was a big study of 541 hospitals with 231,836 admissions for heart attacks that equaled 59% of all heart attacks in America that year. Now, did they all have high cholesterol? Hardly. 75% of those people with heart attacks had, quote, normal cholesterol under 130, and 50% had what we consider optimal levels under 100, and 17% had levels under 70. But what they did find was that most of them had diabetes or metabolic syndrome, with the average HDL or good cholesterol of 39, and the ideal is about over 60, and the average triglycerides of 161, and the ideal is under 70. And 50% had HDL levels under 40, and only 10% had levels over 60, meaning 90% of people with heart attacks had levels under 60. Now that is an indicator of prediabetes. We've been looking under the wrong rock for the problem. It's not fat and dietary cholesterol, it's sugar and refined carbs. In fact, the 2015 U.S. Dietary Guidelines Advisory Committee, after reviewing all the research, has, after 40 years, told us to stop worrying about dietary cholesterol, calling it, quote, not a nutrient of concern. You gotta love that. And they've lifted any recommendations to restrict dietary fat in the diet. I recently interviewed one of the world's leading cholesterol experts and researchers, Dr. Ronald Krauss. He told me that in the 1980s, when low-fat mania was at its heyday, he performed a study taking people with normal cholesterol and fed them a low-fat, high-carb diet, which was thought to be healthy at the time. He was shocked at what happened. He turned them from having healthy cholesterol profiles into heart attack-prone cholesterol profiles with high triglycerides, low HDL, and small LDL particles. It blew their minds, and yet 40 years later, we still haven't gotten it right. So the key is the type of fat you eat that is more important than the amount of fat. Trans fats or hydrogenated fats and refined vegetable oils promote abnormal cholesterol, whereas omega-3 fats from fish and monounsaturated fats found in nuts and olive oil actually improve the type and quantity of your cholesterol. Again, the biggest source of abnormal cholesterol is not fat at all, it's sugar. The sugar you consume converts to fat in your body. And the worst culprit of all is high fructose corn syrup. That's found in sodas, in juices, and in most processed foods. And it's what causes cholesterol issues in most people. Fructose is a problem because when it's ingested in high amounts without the associated fiber found in whole fruit, as in the case with high fructose corn syrup, it turns on the cholesterol production factor in your liver called lipogenesis that makes super dangerous small LDL and jacks up your triglycerides and lowers the HDL or good cholesterol. And so does sugar in any form, including flour and refined carbs. So why are we all so obsessed with cholesterol?
Okay, I'm not going to keep going because he gets into statins, and I'm not a doctor, so I'm not going to tell you to not take statins, but you can do your own research. So just to back up a little bit, obviously, and leading up to these sessions, we've been talking about what's important in a healthy diet, healthy fats, like fat not being the bad guy, but making sure we're eating the right foods. And so the same holds true for when you're trying to prevent cardiovascular disease. A balanced diet is important. Fruits and vegetables are always our friends. If we're going with carbohydrates, we want to make sure they're very fibrous. So those those are our fruits and vegetables and some very whole grains. And then, of course, healthy fats. We're wanting to reduce sugars and processed foods as much as possible. So those are those things that come in boxes and generally in fast food and stuff like that because they're just stripped away of a lot of their nutrients.